David McKenzie there with that report. Now to Anne Rimoin, Professor at the Department of Epidemiology at UCLA's Fielding School of Public Health. She's with us again from Los Angeles. Good to see you, Anne.
Nice to be here.
Okay, so one of the many back and forths right now over Omicron, whether we're overreacting to all of this, we should just wait for more data, or should we be doing more? On that, here's the EU Commission President. Here she is.
At this point, we do not know all about this variant, but we know enough to be concerned. You have read about the multiple mutations and what that might be. And we know from our experience with the Delta variant that it is a race against time.
Kind of seems like a no-brainer. Every time we've waited during this pandemic for more data or something, the end result has been close to a disaster. But at the moment, are we doing the right preparation?
Well, I agree with you, John. I think that we are always chasing behind this. We've talked about this multiple times, and it's time to do everything we can, not only to get in front of it now, but for anything that we have in the future. So what do we need to do? We need to be ramping up testing globally so that we have situational awareness. We also have to be increasing genomic surveillance. Now, South Africa has a fantastic system in place. They're doing a lot of genomic surveillance. We here in the United States have lagged in terms of genomic surveillance, and it's really varied all over the world. So we have to do better, more testing, better sequencing, so we know where this particular variant is, and in the future we know how to identify new variants. We also have to also make sure that there is adequate contact tracing and adequate information out there so that people know if they have symptoms, what they need to do in place.
I noticed you didn't mention more travel bans. And on that, I want you to listen to Mike Ryan from the WHO.
Epidemiologically, I find it hard to understand the principle there. Is it that some passport holders will have the virus and some won't? Does the virus read your passport? Does the virus know your nationality or where you're legally resident? So therefore there are contradictions in this.
Yeah, it's a good point. Yeah, in public health policy, though, there's always a cost-benefit analysis. What is the cost of a certain action? Is the benefit from that action worth it? If there is any benefit from a travel ban, this is debatable, but if there is anything of good that comes from it, is it worth the cost?
Well, you're right. I didn't mention travel bans as one of the things on my list of what we could do to prepare. I think that this travel ban is a little bit too little, a little bit too late, and totally inefficient at the end of the day. We know that this virus is everywhere. We've just seen it now here identified in California. It's in multiple countries. So travel bans are just punitive, and they actually reduce the probability of countries coming forward when they see something new. What I think that we should be doing is we should be making sure that people are testing right before they're supposed to travel. United States right now is thinking about moving up testing instead of 72 hours to 24 hours before traveling, and then have good quarantines in place with people being able to test out of quarantine afterwards. A test 72 hours before travel isn't extremely helpful when you have a virus with an incubation period between 2 and 14 days. So I think that these travel bans are unnecessarily punitive. They might make some small difference on the margins of being able to slow things down, but there's a cost to everything. And I'm not sure that the cost of that kind of slowdown is really worth it for what you gain.
One thing you did mention was getting vaccines adapted for this variant in case they are needed at some point. Right now, there are fears that the global economy could be in for another big hit because of the Omicron variant. According to Bloomberg, governments have already spent $16 trillion responding to this pandemic. That's 16 with 12 zeros after it. Keep that in mind as you listen to this economist from the OECD. Here we go.
It would only take $50 billion to ensure vaccination worldwide. I'm just saying. And if we don't vaccinate everyone everywhere, the supply tensions, bottlenecks, all the imbalances I've just been talking about will also continue to persist.
I'm just saying, $50 billion. Everyone go back. It's mind-boggling. This pandemic, it could have been brought under control by now if everyone had been vaccinated globally?
Well, I'm not sure that it would have been totally under control at this point, but we would be in a much better place than we are right now. As we've discussed on previous occasions, an infection anywhere is potentially an infection everywhere. And so we are tempting fate and tempting the virus to continue to spread by leaving large swaths of the population unvaccinated. And so we should be doing everything we can, living in a world that is interconnected, to make sure that the world has access to vaccines. And not only do they have access to those vaccines, that those vaccines are available in those countries, but they have the means to be able to get them out into arms throughout all of these countries, and also to be able to combat all of the misinformation and the vaccine hesitancy. There isn't just one thing we need to do to be able to get in front of this. There are multiple things we need to do, and that really starts with, right now, getting vaccines into places where they are needed.
$16 trillion, $50 billion. It kind of sums it up. But Anne, thank you so much. We really appreciate you being with us. Some very good points there and insights. Thank you.
My pleasure.